Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
And if anybody that knows us can tell you that we have opinions on things and they're not always right. All right, today, Brad, we're going to talk about top 5 knee exercises to reduce pain and injury. Why don't we go ahead and get started?
Right. This is pretty much general physical therapy knowledge on healthy joint. And we're going to focus on the knee because it's one of the most injured and painful joints in the body, wouldn't you say?
Yeah,
in
it's
our
really
opinion?
discouraging when you hurt your knee because
Right.
it's hard to perform any exercises when your knee hurts.
And right now I've got a 57-year-old woman. She's active, she's working and full-time, and she's got knee
57,
problems.
that's really young.
Well, it is, but her knee was bothering her
Sure.
and she didn't fall on it. Well, she did a year ago, but recently, no apparent reason. So we're doing the same formula with her to get her better.
Wonderful. And if you are new to our channel, by the way, take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also go over to Facebook and like us because Brad and I like to be liked.
Yes.
And we're giving away something really big.
I don't know if we're likable, but let's find out.
Yeah, but we're giving away something really big, so
good.
people will like that.
Yeah, everyone likes that.
All right, let's start off with the first exercise.
Okay,
Brad.
so right down to the very basics, Bob. What do you want to do with the joint? Number one thing as a therapist, range of motion. See if it has normal range of motion, and if it doesn't, let's help it out.
Yeah, that's often a cause of your pain. If it's not, one knee is not straightening as much as the other one, or it's not bending as much as the other one, that's usually a sign of problems, and you need to try to restore that.
And that's the nice thing about knees. Most people have two knees. Oftentimes, one hurts, one doesn't. So you compare the injured one versus the healthy one, and it gives you some good comparison.
Sounds good.
All right.
So we're first. Which one do you want to do first, Brad?
Well, we're going to look at knee range of motion, and let's look at extension. In other words, does the knee straighten out all the way? One simple way to do it, you can just put your knee up on a pillow or a bolster like this, and let's say this is my sore knee, and let's go this way so you can see it better. Here, my straight knee, my normal knee goes perfectly straight. Now, some people will actually hyperextend. The patient I referred to, she's actually one of those hyperextenders.
And that's a problem in itself, too.
It can be, right? Yeah. In her case, her other knee was like this. It was about 3 inches higher. I measured it out. She had about 15 degrees difference. Okay. So the first thing I had her do was, I'll do it on this knee so you can see it better. I just had her simply extend her knee and put some gentle pressure on it, do 3 to 5 reps, and I had her do that every few hours.
Yep. That's the key, is you're going to do it quite often. You're not just going to do it once a day. You want to do it maybe 3 to 5 times, maybe even more.
Yep.
I mean, it's not a problem as long as it's painless.
Right. And in her case, she came back 3 days later, her knee fully extended. We gained full range of motion. But on the other hand, I had her lay down like this, and she couldn't flex it all the way either. One knee she could do this, the other knee about 110, 120 degrees. So then I had her lay down and had her do this stretch. And with her, because of the shape of her body and stuff, she couldn't really do this very well. So I had her reach here, and actually I had to have her towel. Yep, you could use it.
We have a yoga strap.
Yeah, these yoga straps are really nice, particularly with people who have arthritis, which is a common knee problem. They also oftentimes have it in their hands. And then you don't have to have good grip. You can just use your wrists and here, or you can go over the top, depending on how it works.
Or you can even go off the foot.
Sure. Yeah. And those straps will go right through your toes. So, Bob, you got any other tricks for this?
Yeah. The other one that you might do is just simply go up to a chair, or a countertop or something which you reach. That'd be a little high for most people.
Right.
But you could lean forward here and do a little pressure on, pressure off, pressure on, pressure off. Now, if you want to get a little more advanced in that maneuver, this one often works with people who are having trouble with like a meniscus or a cartilage problem.
Right.
Is you're going to go ahead and you're going to put the foot up here, and you're going to take your hands and you're going to actually turn the leg. So it's going to depend on which leg you have. If you have the right leg, you're going to actually grab the bones here and turn them counterclockwise.
Right, so rotating
it this way, yep. So I'm going to turn it, and while I'm turning it, now I bend the knee. I'm going to turn it, I'm going to bend the knee, I'm turning the whole time I'm doing this. And you can do 5 reps, should be painless, absolutely painless. If it hurts, I don't want you doing it.
Right, and painless And you should gain range of motion.
Right.
You say, oh, wow, it's bending now and it doesn't hurt. When you get that response, you're gold.
If your left knee, I'm just going to want to go over this real quick,
Yep.
Brad. You're actually going to turn it clockwise this way.
Sure.
And now you're going to turn it and then bend. And again, I'm turning the whole time while I'm bending the knee.
Right.
Look at that crack. You hear
Yeah.
that?
Oh, yeah. Did it hurt?
No, it felt
No
good.
pain? Good.
Yeah.
Excellent. That's what we're looking for.
All
so
right.
that's the first step is get the range of motion. Once you establish that, you're back to normal. Then
Do some strengthening.
yeah,
Do you
we're-
use this?
Yeah, we're going to.
Oh.
You can use a 6-inch roller, or you can use a rolled up towel if you don't happen to have one. Usually, you can roll up a towel and put that there. But we're going to just work quadricep.
Oh, that's right.
strength.
Sorry about that. We
Yeah.
skipped. We skipped around. I forgot that one.
Yeah, and you can simply. I like to do it in a long seated position, probably do it on a carpeted floor, and just simply, this looks like a really simple thing to do, and it kind of is, but if you got a sore knee, this may not be so easy. So you want to get full extension, hold it just for a couple seconds and down, and if it is too easy, if you happen to have an ankle weight, 1 or 2 pounds is all you would need. If you don't have ankle weights and you live in the North Country like we do, put your winter boots on. They usually weigh 1 to 2 pounds. I'm serious, Bob. You know, your muscle doesn't know if you've got a lead weight on.
Sure, gotcha.
Right. Or, you can improvise with a sock and put on some,
Sure.
put some rice
Weight
in it.
Sure.
And that'll wrap right over there. This is home remedy stuff.
Yeah.
We don't have to spend hundreds of dollars for fancy stuff to get the same results. You're going to do 3 sets of 10 of these. You might start out with 10, and it might be sore. But over a week or 2, you can build up to 3 sets of 10.
So we're building up the muscle on the front of the thigh.
The
So now we
quadricep.
also need to build up the muscle on the back of the thigh, right?
Sure.
So are we done with these?
Yep.
Okay.
Yep. We're done with we call those short arc quads in the therapy world.
Yeah.
At least we do. I don't know. Maybe they got something new nowadays.
Sure.
I like this one because you get to lay down and rest
You
a
want
little
a pillow?
bit. No, Bob. I don't want a pillow. But I'm glad you're thinking of me. Hamstrings.
Hamstrings.
If you just lay down and you pull up like this, and I pull my heels towards my butt, that's a good isometric hamstring strength.
And you get a little bit of the hip extensors too, which is
Sure.
good.
Yep.
You want them to work together as a
Right.
unit.
And a little core as well, Bob.
Yep, and a little core.
Yep. And you can do that, hold that for 6 to 10 seconds, and then relax.
And if you want to make it harder, Brad,
Oh, yeah. That's the thing about therapists. We're always
Yeah.
trying to make things harder if it gets too
is
easy.
that harder or easier?
Yeah, it's a little harder, Bob. It's a
Ah.
little more on the
Sure.
hips and the core.
I thought it would be harder.
And naturally, Bob, you know me, the beauty of the ball, I just
Sure.
love the ball. Whew. If you happen to have a ball like this, if you're not, and you want to get one, you'll use it a lot, especially if you watch some of our videos.
Yeah, this is one I do all the time.
Okay, so is this how you do it, Bob?
Yeah.
There's a lot of ways to do it, but just pushing down is a nice way to do an isometric, and you got some, it's not like pushing into the hard floor. You got a little
Right.
give there, which is kind of nice. And then, now I think it's important that you start with your knees
Sure.
fully straight, lift your butt up, and then roll it all the way up.
Well,
Whoops.
first you could do just rolling it back.
Oh, sure,
yeah,
right,
just
yeah. Good point.
Pushing
Bob.
down while you're rolling back.
Yeah, so I'm going to squish the
If
ball.
you're new to this,
Yep.
you probably want to start it this way.
There you go. If you can tell I'm squishing that ball a little bit
Yeah.
and rolling it, and then as you get better, you can do 10 of those. And as that gets easier over time, over a week or 2, you may want to lift up, and this gets quite a bit harder. All the way out straight, all the way bend, and then you can even progress to one leg over the top. Now the bottom leg is emphasized and is doing quite a bit more work. And when you get really advanced and you're in the Olympics, you could do one leg, but
You don't even need to be in the Olympics. I do those.
wow, Bob, you
I'm
should be in
old,
the Olympics.
yeah.
I can't wait to see Bob in the Olympics.
Yeah, the senior Olympics. I don't know if they have those or not.
Okay.
Okay, well, where are we at? We had squats? No, you're doing step-ups.
Yes.
And I'll do the ball.
Yeah,
ball.
maybe we get over there. Now, where's my cane? Can you slide that chair over for me,
Sure.
Bob? This is a real technical kind of an exercise. It's simple, but you have to do it right. So you can go to a stairway or a stool like we have here, and you're going to line yourself up like this. Yeah, good
One
idea,
thing
Bob.
that's important here is that you don't want the knee coming in this way, and you don't want the knee going out that way. I mean,
Right.
you want it straight up and down. This is very key for athletes.
Right.
I mean, we really want them to learn to land like that. And what you'll see with a lot of injuries, especially like ACL injuries,
Right.
they tend to land with the knee in.
Yep.
People land like this. A lot of girls do this.
Right.
And that's one of the big things we try to teach them is to land correctly.
Right. Get the mechanics so it takes the stress off those ligaments and where it should be in the muscles in the joint in a healthy alignment. So this is the motion we want to avoid. And it's just one of those inherent things. Oftentimes that happens, people aren't even aware of it.
Well, especially women who tend to be a little wider in the hips,
Yep.
and so their knees tend to want to go that
Right.
way anyway.
And we're not being sexist. They've
No.
studied that. There's called a Q angle, and it is
Right.
because of the anatomy of the bone structure. One way or another, this is what you want to do, whether you're male, female. Is
And this is the starting point, and then the finishing point could be you actually do some jumps, keeping the legs lined up.
Yep. If you want to
If
get
you're into athletics.
right, I'm going to show it from this angle.
Yeah, because here now what he's doing is he's avoiding getting the knee past the front of the foot.
That would
That's
not.
bad. This is good. So you got a lot of things you got to concentrate
Right.
on.
Look at this foot. If I go down and touch with my toe and I push up with my toe, that's kind of what we call compensating or cheating.
Right.
Ideally, you want to keep your foot like this. I'm just going to touch my heel like there's an egg down there, and I'm not going to touch it. Now, I need this for balance, and I need this cane because I really want to do these properly.
So why don't you go ahead and put the foot down once, Brad. I'll show you what I do when people do that.
Oh! Yeah, see, he's a nice therapist. Everybody wants to see Bob.
Cane and torture. That's what physical therapy stands for, PT.
Repetitions, the goal is 3 sets of 10. You might start out with 10, will be enough for a day, and as you build up over a few weeks.
Let's go to the ball on the wall,
The
Brad.
ball, the famous ball
Oh,
wall.
now we're changing it. We're adding to it.
Yeah.
So here, let's get this out of the way. All right, just simple squats on the wall. The ball works great for this because you can keep the knee in good position. Hopefully I won't slide forward because
Right.
I got my
He'll
slippy
slip.
shoes on.
Right, so he's got kind of leather shoes on.
So you can
turn
go
to-
way down. You can get the legs level.
Right.
Think I'm level?
Oh, let's look at it. Go. So he's talking about there. If you don't want to go farther, then go down.
Yeah, I don't know if I can
Yeah,
even do that.
yeah, that puts a lot more stress on the knees, and there
I
may
usually
be
like to
some.
do some posture with this too. I usually
Oh
go
yeah, look at
this,
that, Bob. Yeah,
do some posture exercises
there you
while
go.
I'm doing these.
The beauty of the ball.
Yeah.
Again, 3 sets of 10 is the goal. You may start at 1 set of 10 and get. Bob, you're right in my way.
sorry.
People can't see me talk, and I don't know if they want to see me or not. It might be a good thing. Anyways, excellent way to work on those knees. First the range of motion, then the strengthening, and then the weight-bearing exercise and the mechanics. Bob,
Nice progression.
this is one of those things where we can fix the knee, but there's that one part they were having a hard time,
Brad and I can fix just about anything.
except for that.
Broken heart.
But we're working on it.
We're working on
You know, there was one of those little video things. They're right in the way of the broken heart. I was watching one of our films. Can you fix that?
A film? What?
Those little push button things if you want to watch another video at the end.
I can have it. I'm gonna put it over your face again.
That'll
All right,
work.
thanks.